I'd like to start by acknowledging the traditional owners of the lands on which I'm recording this, the Wurundjeri people of the Kulin Nations, and I pay my respects to elders past and present. I also want to thank Tegan Taylor for facilitating and acknowledge each of the esteemed panellists joining you today. Conjoint Associate Professor Carolyn Hullick, Professor Julian Treloar, Professor Edward Strivens, Affiliate Associate Professor Juanita Breen. The findings of the Royal Commission into Aged Care Quality and Safety and the Royal Commission into Violence, Abuse, Neglect and Exploitation of People with Disability unearthed some truly disturbing practices and standards in the Australian health system. For many, the findings were as shocking and surprising as they were saddening. But for others, those who had suffered and their loved ones, it was a watershed moment, one where years of advocacy and calling for change was now possible. One particularly upsetting discovery was the overuse of psychotropic medicines being used to restrain vulnerable Australians, older Australians and people with a disability, people who need to be looked after. Now, there is a role for psychotropic drugs in healthcare, but across the board, psychotropic medicines are overprescribed and overused. They're being used to soothe, sedate, and influence people into care who are exhibiting concerning behaviour. There's little evidence that psychotropic medicines are effective in managing behaviours of concern in people with cognitive disability or impairment. In fact, there's evidence that suggests the opposite. Non-medication strategies are the best way to prevent and address behaviours of concern. And psychotropic medicines are a high-risk medication that should be a last resort. It's why it's time for more rigid standards to protect the health of our most vulnerable Australians. And it's why it's an honour to be launching the new Psychotropic Medicines in Cognitive Disability or Impairment Clinical Care Standard. Professor Duggan and her team have worked so hard on these new standards, and I congratulate you for the work you've done. It's going to make a big difference. A new gold standard that will be enforced to protect Australians. A standard based around managing the risks associated with psychotropic medicines, around supporting carers with diagnoses, improving behavioural support planning, and promoting preventative and de-escalation strategies. A standard that will strengthen provider understanding of informed consent and the appropriate administration and monitoring of psychotropic medicines. A standard that will improve the healthcare system, because we are constantly striving for a system that protects Australians, particularly those who are vulnerable. And that's why we all do what we do, right? This standard is only possible because of the hard work across federal, state and territory health bodies, clinical experts, the private health sector and the valuable guidance of patients and their carers. So I want to thank all of you there today who are involved with this work. You are improving the lives of so many people, and that is no mean feat. Congratulations and thank you.